Steroids. When most people hear the word steroid, they think the recent baseball scandal or some athlete who failed a drug test and now in trouble. There's a lot of evidence out there that shows the negative effects of steroids far outweigh the short-lived positive effects that one may get from them. Using steroids is a big decision. It's a very complex decision. And if most steroid users or abusers knew these effects or side effects that you can get from steroids, they probably would not use them or even think about it, because these effects are very detrimental to one's health. These short-lived rewards that you get from them are not worth the many side effects that you get from them. What are steroids? Steroids are a organic compound that is usually synthetic and created to mimic the hormones of the body. There's many different hormones in the body, just like there's many different steroids that affect these hormones in many different ways. Steroids can help the body, and they can hurt the body. Who uses steroids? Like I said before, first people, when they hear that word, they think of the athlete or the big bodybuilder. And, that is true, that most of these people do use steroids. But it's becoming a bigger issue or problem with our adolescent who are turning to them because of their quick fix, and allows them to work half as much and not as hard and get twice the benefits from them. And everybody's like, oh, that's great, but once you hear about all the negative effects that steroids have, it's not so great, because they can be as mild as acne in men and women, hair loss in men and women, deepening of the voice of just women, or making a man's voice change too. These are some of the milder side effects. The more harmful side effects would be major organ failure, heart problems, high blood pressure, cancer even. These are all very serious medical issues, and they're not easily fixed, and can cost you a lot of money to try to prolong your life from the use of steroids, and which, as I said, is a very complex decision to make and carry out without the supervision of a doctor. These effects are not always negative, but even after one decides to stop using it, these effects can still be very much a problem, because as we've seen in recent news, several athletes have committed suicide, and the doctors are saying that it could be related to steroid use and or abuse. Once you've stopped taking steroids does not mean these side effects just go away. You've already done some damage to your body, and now that your body doesn't have all these hormones that it is used to, or has been getting used to, then it doesn't know what to do, and it's no longer producing these hormones because it had them at such high levels. Now your body doesn't produce them. So, as I said, these effects keep on causing you problems even after you've stopped. Any questions?
Are all steroids bad?
No, not all steroids are bad. Doctors use steroids all the time for medical treatment to help cancer patients gain some strength back and gain some energy, so they can actually still do stuff and don't lose the hope, and it helps their body heal itself faster.
Who all take steroids?
As I said before, there's many different people. Women, men, athletes, non-athletes. It's became such a easy, quick fix for people that may be overweight or people that have been picked on a lot. They can get big and strong and no longer be that little guy anymore. But these side effects that they get from it can shorten their life by many years, and these side effects just aren't worth the reward that you can get.